Let me get to our next story. By the way, he's playing this song tonight. He played this last night, Band on the Run, so you're going to be hearing this tonight as well. Okay. Let me get to the next story because, again, we've been talking so much about Bill 2, doctors, etc. This news seems to just get, I was going to say bigger or more expansive every day in terms of other provinces now weighing in. So look, it seems as though the private sector is taking advantage of Bill 2. Now, remember, we have a public system here, but there are, of course, private systems. I talk about La Croix, private medicine. It's a private clinic. And here's the deal. Private clinics are realizing the doctors are concerned, those in the public sector. Some are talking about leaving. We know that I think more than 300 doctors have already said they're looking into investigating the opportunity or options of practicing somewhere else. So this shouldn't come as a surprise. They're being, I guess, courted to consider working in the private system. In fact, La Croix had an ad, I don't know if you saw this a couple of weeks ago, full-page ad in the Montreal Gazette, which says, "Notice to Quebec specialists and general practitioners. Are you considering retirement or planning to leave Quebec soon?" And then highlighting, right, it says, "In light of major reforms to the healthcare system here, many physicians are reassessing their professional future, considering retirement or looking for a change in their practice." And then it goes on to suggest they contact, La Croix Private Medicine because they're hiring. So this is something that's going on over and above those considering making a move outside of the province. Dr. Pascal-André Vendittoli is president of the Fédération of Private Practice Doctors here in Quebec. He is on the line. Doctor, thank you so much for your time. Let me begin by asking what you're hearing and how many people are suggesting, you know what, maybe rather than leave, maybe what I need to do is move into the private practice system here.
It's now it's very present, in the medical field. People are really unhappy about the way the government treat them in the day-to-day practice. So they were asking for years to get better working condition, and the government not being able to provide better working condition for their employees. What they try to do is put bills, laws, regulation, and to keep their employees prisoner of the system. So this then people feel like treachery. They don't feel, because they are putting all their energy, their will to make the patient care the best in Canada, and now we don't deserve this kind of action from the government.
The other issue I said about some considering moving from public into private clinics now, looking to hire those doctors, disenchanted. Meanwhile, and this is kind of new, Alberta is weighing in here. Now, remember, it was first Ontario, New Brunswick. They were close to Quebec. They're the ones you heard Doug Ford, of course, suggest that Quebec doctors who are unhappy maybe consider coming there. So Alberta is now saying they plan to implement what they call a mixed private and public system, which would allow physicians there to simultaneously offer services in a parallel private market, which I believe is something doctors here have been asking for as well. Am I right?
Yes, the Fédération of Doctor in Private Practice, which I represent, are asking for a mixed system for years. We believe that this is the only way to provide more care and also better care to the Quebec population, because we need a fair competition between the public and private care. And I think what they decide to do in Alberta is really the best way of doing this change in the healthcare system that will maybe bring a new way of practicing with patient not waiting 2 years to get their surgery.
So explain how that would work. So you're a doctor in the public system. If we were to have the same system that they're now going to have in Alberta, you wouldn't have to opt out of the public system now to go private and then opt back in to go public again, which is something you can do here. How would it work?
Yeah, it is all based on patient autonomy. So we give back to the patient the decision. If they want to be treated in the public system because they believe they have a trust in the public system, and so they can go there. If they want to get a different care, a different way of getting their treatment, then they can go to private. If the patient is the one who decides which is the best, then the market will evolve according to the quality of each systems. Currently, the patients in Quebec are captive of the public system, and they are imposed long waiting times. So they go to private only to skip the queue, which is not the way should work the public and private cohabitation.
And why has the government up until now refused to consider that?
It is very difficult to understand because we have multiple examples in the world where we see that when you put the bills, law, regulation, and you try to keep captive the patient and the doctors into a system, it doesn't work. It creates problems. And even worse, the private care becomes a bad sector. So if you leave the private sector free of rules and let the patient decide if they want to go in private, then they will have they will need to prove the value of their care. And this is, I think, the only way both can live together. And you know that if the public system is very good, very effective, private care would just be minimal. So I think the challenge is really in the end of the government to create the best public system available. And this is the best way to control private care, not with regulation and laws.
So, and just so I understand, or our listeners understand, right now, if you're a doctor, say you're a specialist, right, and you're in the public system, and you decide to, for however long, a month, 2 months, go into the private system, you can do that in Quebec, right? But you have to leave the public system and then come back? Or is there a law now that will change that not allows you to do that?
Yeah, I mean, they had a very bad strategy, the government, the la CAQ. They knew that they would put the new bill number 2, which would be unacceptable. So in April, they create another bill called Bill 83, and this strategy was to close the door from the private sector to the public doctor. So from April 1st, there's no more public doctor who can opt out of the public system in the long term.
Okay.
So they knew that this would be a way to escape the public system to go to private. So they knew ahead that it would be a big option. So they closed the door and they create Bill 83. And now the only way to practice in private is only for short period, 1 week, 2 weeks.
And after that?
You need to go back to public system. The only doctor that can practice in the long term in private were the ones who were out of the public system before April 1st.
I see.
So as me, I was in private practice for years, so I could stay in private, but all the new ones and the ones who would like to escape, they cannot go to private anymore.
Yeah, it's an interesting choice of words, escape, because that's, I'm sure, what it must feel like for some doctors. Dr. Vendittoli, I thank you so much. I appreciate your time this afternoon.
Thank you very much.
All right. So that's where we are. Still a very strange situation here. Interesting that Alberta is now considering this or planning to do this, right? Mixed private and public. You'd think that, as he said, that'd be something Quebec would consider? No.
The newest tracks. Let's go. New music. And the next big thing.
Always on the new music first.
Your first place to hear it all.
'Cause you gon' like it, love it, wanna play it twice. Playing now.
iHeart New Music. Your digital station for brand new drops, fresh finds, and tomorrow's bangers.
I think we need something new.
Discover iHeart New Music. Always fresh, always first. Stream now on the free iHeartRadio app.